told that your child has cancer is probably every parent's worst nightmare. Parents can feel lost, isolated and confused. Children will very soon pick up on how you're feeling, which may make them scared and confused too. It's important to talk to your child about their cancer in a way that they'll understand. Don't be afraid to ask the treatment team questions. They're there to support you. Knowledge is empowering, and understanding your child's illness will help you to stay focused and in control.
I think around 2 to 7, children at that age are very much in the here and now and very noticing the world around them, and therefore the first step in talking to children about what their experience is building on what they've already noticed.
She's never asked difficult questions. She knows she had a brain tumour. We never used the word cancer because I think for anybody when you use that word there's so many connotations attached to it. Everybody knows somebody who's passed away from cancer, so we've tried to hide that word away from her. But she will talk about her brain tumour, and she talks about it in such a childlike way that it's almost endearing, you know, and she's made it very easy for us.
We've got to take this down. It's not much of a place. Because we're going to move house and we've got to take all this down.
When thinking about the amount of information to give your child, it really will depend on their age. From a psychologist's perspective, we would always believe that being open and honest about a diagnosis is very important, because you as parents would probably want to be the ones in control of the information your child has, rather than somebody on a ward who might tell your child something about their illness that they don't know yet. That is always possible and likely. However, if you're in control of the information, then you are the one that they can come to when they've got their questions.
But what we have tried to do is make sure that we're very honest with him, but not to give him ifs, buts and maybes. We try not to give him things that are going to worry him.
I try not to keep anything from Michaela. We do talk round the dining room table as a family with all the children. I have 5 siblings, ages from 14 down to 1. And we talk very openly within the household about cancer. There's nothing we keep from the children. When she's ill, we tell the other children that she's ill. When she's happy, they obviously can see that she's happy. But there's nothing to hide, because secretly, if you don't tell them, they start asking questions or they get their mind in a pickle, especially my 14-year-old. If you don't tell them the truth, what's going on, they go off on their own tangent and think the worst case scenario when it isn't all that bad at that present time.
The children to start with just need an overview, some information, and then they can gradually, given the right information, ask more questions at a pace and a time that makes sense and gives the right information to them.
I think because we were so open and honest with Danielle, in the fact that she knew exactly what she had right from the word go, and she wanted to see the MRI pictures which the doctor showed her, and it was always her marble because it looked like a marble. Although she was only just 8, that was the way to go for us. I think that actually she needs to be told the truth so that she's not frightened. Whereas I always used to think if I held it back from her and she found out from somebody else, then she wouldn't trust me, and I needed to know that she trusted me. And so with Laura, we were exactly the same, because obviously I didn't want to put Danielle in a position where she couldn't tell Laura, she couldn't talk to Laura. So I think both of them knew from right at the beginning really that what Danielle had, what treatment she was going to have for it. Laura didn't ask too many questions, I don't think, not to me anyway. I think she spoke more to other people maybe. I know she spoke to my sister, but I don't know, maybe because we were so open and this is what it is and this is what's going to happen, that actually she didn't have any questions to ask.
Thinking about a very young child, you may want to talk about their illness. You can use the word cancer, but you may want to talk about their illness in picture form. You may want to think about using objects such as dolls or play toys to kind of show them where their problem is, point to their head. Almost some children may have a doll that represents their illness. So I've often seen on paediatric wards little dolls with cannulas in and eye patches or different shaved bits on their head, or that can be really useful so that the child begins to understand where their illness may be. They may not understand the extent of their medicine, and actually at a very young age they're going to be more concerned about being away from you during treatment. So helping them understand that we will come back, we're not going anywhere, asking medical teams to make sure you're heavily involved in all of the different stages of treatment. So when they're having their first cannula put in, or if they're having an MRI scan, being there as a voice through the machine can be very useful, and helping your children understand that you're not going anywhere.
If it was me talking to a parent, then I would say talk to your kid, let them know what's going on. Or otherwise, their imaginations are just going to go wild, and it's actually going to be worse than actually what's really going on.
As the child gets older, the information that you can give can be more detailed. There will be leaflets out there which are available, which show as well in pictorial form where the illness may be, a person's journey on a treatment. Sometimes it's useful to tell a story from a third person point of view. So Johnny had an illness, he went to hospital, and there are some books available for that purpose as well.
I do remember once when she was going up for an operation, she did say to me, "Mum, will I still be alive after the operation, or are they going to take it away and then I won't be alive anymore?" And what can you say to that really? It's just there's no answer. You just have to say, well, you know, they'll do the best that they can, and you'll be okay. And that was the only time I think that she ever asked me anything where I was just lost for words. I just didn't know what to say to her because I couldn't make it right. It was awful.
So if you're able to help them understand it's not their fault, they didn't do anything wrong to get this illness, but this is what it is and this is what we do next, that can be very helpful. The adolescent stage, your child is going to have more questions than you can probably answer. So I think this is where you get very prepared. This is where you may have a nurse in the room with you who can also answer some questions. You would volunteer some information, but you would also ask, what do you know? What do you understand about your illness?
And we asked all of the children what their understanding was about the sister's illness. And by God, their understanding and the true understanding was two totally different things. So from then onwards, we corrected what they were thinking. And then once a month, roughly now, unless they want it sooner, we sit around the table and we talk openly as a family about where we are with our illness, what the scan results show, what that actually means for us, her, and everybody within the household. And that helps us as a family to talk openly.
And it was like, ooh, first of all, when I first met him, I was like, oh, you're talking to a 7-year-old like that. But I'm glad that we had him, because I don't know whether we would have been quite so open if we hadn't had him. This is what's in your head, Danielle, this is where it is and this is what we're going to do. And I was like, oh, he didn't ask me to whether I could, do you know what I mean? He didn't ask me if he could say that. I'm glad he didn't, because I probably would have said no. So I probably, do you know what I mean? I would have probably said, oh, you can't tell her that. But looking back now, I think, thank goodness he did, because I think that's probably what got her through it.
As a family, I think we've all grown up quite a lot. The children act a lot older than what they actually are within this household, because the illness has taken over within the household. It's hard to be children.
You know your child's personality, their fears, what makes them laugh or cry. Try to be honest with your child. It's important that they trust you. It's going to be a long journey. Questions that children often ask. Why me? Will I get well? What will happen to me? Will I die?
Actually talking about death as a concept, as an idea of, yes, actually, we will all die at some point, but actually, because of your illness, it may mean that you die sooner than we wanted you to. and then ask them if they have any questions about that and what that means. For some children, they will have the explanation of going to sleep. From a psychologist's perspective, I don't think that's very helpful, because they can become very fearful of going to sleep because they think that might happen every time. So it's a very tricky place to kind of start conversations. However, saying to a child, yes, you might die, but we're going to be right by your side at all times. We're going to be here. You're not going to be on your own. We will make sure that you're not in pain, you're comfortable. As much reassurance as you possibly can to make sure that child doesn't feel they're going to go into a stereotypical black hole, disappear and be alone. I think often children fear being alone more than the word death, because sometimes they don't understand what that really means.
The biggest question that Michaela's asked me that's been difficult to answer is, am I going to die? I can't answer that. I don't know how to answer that. I remember saying to her that we're going to give it a huge fight. Cancer's got to beat us before it... we've got to beat cancer before it beats us. Never give up.
Death is a very scary thing to think about, but it's not happening right now. Let's think about how we live our lives together, and the happy things we can do. Can also be a useful end point to a conversation about death.
I wish my parents had told me more about my brother's illness. And I know they were trying to protect me, but really it actually made me feel worse. And it just made me feel really worried of sort of like, my brother's ill and my parents aren't saying anything about it.
I think being prepared as much as you can, you knowing as much as you can, it's a whistle-stop tour of you becoming a medic and having that knowledge, and how you impart it with your child will depend on their age. Pictures, images, fact sheets as they get older. Truth is probably the most helpful part of what I would advise a family to do.
As he started to recover, then he started to ask a little bit more, and he had a real issue at that point with the word tumour.
I think my experience with families is it's not something families go out to decide, this is what we will call it. It actually kind of evolves within the family. They suddenly find a child has called it this, or they're naming it something, and I think that's okay, so long as it doesn't become a fantasy thing that is unreal, if that makes any sense.
I think the job as a psychologist is often to get those taboo subjects out in the open so they become less feared. We really need to be able to challenge the taboos of cancer, death, dying, to be able to help children, families have useful conversations about them. Otherwise they become shut away, and that's not really going to be a helpful place for them to be, particularly when you're facing a journey like a diagnosis with a brain tumour.
It's natural to want to protect your children, and sometimes hiding the truth can seem like the best thing to do. However, many children are tougher than you would think and would rather know the facts than be fobbed off or kept in the dark. Many children will already suspect that they are seriously ill. Obviously, you know your children better than anybody, but if you are in any doubt about what to say or how, please speak to your doctor. They may well have a mental health professional or counsellor who can help. If you would like further information on any matters raised in this film, please go to www.jossearchlight.org.uk.